Okay, so let's begin. All right, so welcome. The objectives for this training is really a variety of things. So first, I'm going to break it down to you, really the truth about advocacy. There's a lot of misnomers out there to really give you kind of the 101 on what's really effective and why it's so important that you are participating in this year's Advocacy Day. We'll talk about NEDA's policy focuses. So we have two of them this year, the Eating Disorders Prevention in Schools Act and NIH research funding for eating disorders. We will talk about your pitch. That's what we here on Capitol Hill in Washington, D.C. call it when we are talking to our congressional representatives and asking them to do something. We call it a pitch. We'll talk about your meeting structures and then your personal story or stories if there are going to be multiple people joining you for the in-district Advocacy Day. So just to start by level setting everyone, we have received over 400 people registered for this first annual in-district Advocacy Day, which is amazing. I'm personally blown away, and I know NEDA's team is blown away. And all of you should be in the process, if NEDA has reached out to you, with actually scheduling your meeting with your member of Congress's office. So if you have not heard from anyone from NEDA on this, it's likely someone else will be going with you to the meeting and scheduling, and we'll talk about that a little bit later. But just knowing that's really where you're at in the process, and this training is really to prepare you for your meetings next week.
Hi, my name's Jenna Hollander. I just joined.
Hey, Jenna. All right, so let's just start with the truth about advocacy. So I think the most important thing for everyone to know here is that you have the power. You are a constituent of your member of Congress. And so what a constituent is that's just a fancy word here we use in DC that really just means that you are a voter of your member of Congress in that congressional district. So because you are a voter, you have all of the power. You have the power to tell your member of Congress what you want them to do. And that's really what advocacy is all about. A lot of times I hear people saying, well, you know, does my voice really matter? Absolutely, your voice 100% matters, and I hear it every single day. I'm on Capitol Hill on behalf of the National Eating Disorders Association at least 3 times a week, and the number one thing that they ask of me is, who are our constituents and what are their personal stories? So just knowing how important you are in this political process and knowing that when you're going into this in-district Advocacy Day, meaning going into the office of your member of Congress, your voice matters and they really, really care about it. Because in essence, you're their boss is the most important thing to keep in mind. So it's really important that you're sharing your personal stories because they can change the hearts of congressional staffers, the hearts of members of Congress. It changes the federal stigma, as there is still a lot of stigma as it relates to eating disorders in the federal government, and it also changes policy. So it's such an important role that you are playing here, and so I'm glad you are participating. So just some facts here to back this up. So 54% of congressional staff actually agree that an in-person visit from a constituent has the most influence compared to other forms of advocacy. That is over half of congressional offices, which, mind you, is over 400 offices, that believe that you have that power. That is the most valuable form of advocacy that comes across them day to day. So if you want to look at this overall, here is really what these surveys actually show. So 54% will say that in-person constituent visits are the most effective. The next most effective, if you can't be in person, are personalized emails. So that is about 30% say that those are very effective. I find that those are also extremely effective. So if you ever get outreach from our colleagues at NEDA, such as Jocelyn or Shavis or Carrie, know that you writing that personalized message to congressional staffers is so very important and very effective. A letter to the editor referencing the member of Congress, that's another form that's effective. Comments on a telephone town hall, and then a form email message. A form email is basically a template email where you don't put anything personal about you. It's not that effective, but it is another form of advocacy.
Yeah.
And then I'm pressing mute all for everyone, but just as a reminder, make sure that you are muted, just so that we can have everyone listening to the webinar. Thank you. Okay, so let us talk about our first policy ask of this in-district advocacy day. So our first ask is for legislation preventing eating disorders at the school level. We are calling this the Eating Disorders Prevention in Schools Act. So a little bit about this. So eating disorders, I think as everyone here on the call know, they start off young. But unfortunately, our federal laws really only focus on obesity. And this just becomes a huge problem. As Congress is really thinking about this obesity epidemic, they're not thinking about the other side of the coin, as I say, eating disorders. So studies show that large number of students meet the criteria for high eating disorder risk or warrant clinical referral. So this is pretty large across the board. Over half of students living in higher weight bodies, a third of normal weight students, and a fourth of underweight students will meet this criteria. Another important stat for you to keep in mind is that 1 million adolescents every month resort to weight control behaviors. And 2/3 of children living in higher weight bodies are at risk of developing an eating disorder or engage in unhealthy weight control practices. So what this tells us is that activities that are happening in the school, in addition to the normal daily things like social media, are really having this perverse effect on our students at a young age. And as I mentioned, many federal policies require school programs for nutrition education and obesity prevention, but they don't include any eating disorders prevention. And so this really becomes the big problem that we're seeing. For example, seeing BMI testing in schools, which we hear all kinds of anecdotal cases of this being a triggering effect, as well as other obesity prevention activities. So in turn, we are working on the Educating to Prevent Eating Disorders Act. And really what this bill would do is three main things. So in essence, under federal law, what is required is a local school wellness policy. This is a policy that when you are receiving a free or low reduced cost lunch, you will have to have this policy in place to receive this funding from the federal government. So what the federal government says is that to receive this funding, your local school wellness policy has to include a variety of things, including nutrition education, obesity prevention, and what the bill that we are advocating for is basically adding in eating disorder prevention within those school wellness policies. So it would do three things. First, it would require eating disorders prevention within the local school wellness policy. Second, it would encourage screening for eating disorders. Third, it would include mental health experts within the development of the local school wellness policies and training and technical assistance provided to schools from mental health experts. This is through SAMHSA, which is a Substance Abuse and Mental Health Services Administration. Yeah. So we just had a question come in here. The question was, what is the actual bill? So the actual bill is this. So this is what the actual bill will do. The bill has not yet been introduced. We are expecting it to be introduced next week, and we'll talk about who those leads are. So the Eating Disorders Prevention in Schools Act, our main lead is Congresswoman Alma Adams. So Congresswoman Adams, she actually sits on what we call a committee of jurisdiction. A committee of jurisdiction is the committee that makes the initial decisions regarding whether to move or not move a bill. So Congresswoman Adams actually sits on both the Agriculture Committee and the Education and Labor Committee, which oversee this particular piece of legislation. As well, we will be having a Republican lead. We have a number of cookers in the kitchen here, so we are just waiting for this to be finalized, being why you have not yet received this information for us, because we're just waiting for that final Republican to come in to make this bill bipartisan, but we expect to have that within the next week or so. And then I see a couple of questions here. Thank you guys for having these questions coming in. The first question is this info going to be emailed to us? Absolutely. So Karen, this info will be emailed to you, not only the PowerPoint presentation, but you'll also be receiving an infographic that walks through everything that the bill does. And then you will also be receiving what we call a cheat sheet, which walks you through everything that is included and the draft text of the legislation. Renee also has a good question. Renee said, would mental health personnel be the ones doing the screenings? Renee, that is such a good question. And so, you know, we are keeping it a bit broader. We're keeping it to school health professionals. And the reason is unfortunately, mental health professionals in schools are very limited. I would estimate from our colleagues at the National Association of School Psychologists that there are only about a fourth of schools, perhaps at most, that have a mental health professional. So we're targeting school health professionals just to make sure that schools, whether they be rural, urban, suburban, low resource or not, are all able to do these screenings. The next question we have here is from Emma Roberts. Emma asked, would the screenings be self-reported? So these are all wonderful, great details that are actually figured out within what we call the regulatory process. So on the federal level with the bills, we have them a bit broader, whether the screening will be in person or self-reported. But on the regulatory level, NEDA will be actively advocating on how they would like the screenings addressed and conducted. Okay. So, you know, as you're thinking about going into next week, and again, you'll be receiving all of this information via email from our NEDA team. But the number one ask for this piece of legislation is to co-sponsor the Eating Disorders Prevention in Schools Act. Why co-sponsorship is so important is that many committees will not even pick up a bill, meaning they won't mark it up until they receive at least 10 to 20, often bipartisan co-sponsors on a particular piece of legislation. So that's why having you go in and asking your member of Congress to co-sponsor the bill is so very, very, very important. So I'm going to pause here. I just want to see if anyone has any questions. And let me see if I can figure out how to unmute you guys for 1 second. What did I do with that? You would think I'd be more tech savvy. So I guess if you have any questions, maybe if you could put them in the chat box, and I will be able to answer any questions right now. So I'm going to pause to allow anyone to add any more additional questions. The next question is, will NEDA provide training programs to educate those to teach school personnel? That I do not know how to answer that right now, but how about we follow back up with you? Oh, great. And then Karen, thank you so much. Karen, let me know that you can actually unmute yourself. So feel free to unmute yourself right now if you have any questions. Thank you, Karen. You're much more tech savvy than I am.
I have a question.
Yes.
So we're asking these specific questions about, you know, if mental health will go in and do it, will it be self-reported? Is it likely that the the staff is going to ask these kinds of questions, or is that sort of not really on their radar and it's more they just need to hear this information?
It's more that they need to hear the information.
Okay.
So unfortunately, to all of our dismay, the federal government doesn't get too caught into the weeds. That's really the number one way to get something passed, is to keep things a bit broader. But then once you drill down on the federal agency side after it's passed, that's when we get into these weedy details.
Okay, I just didn't know if I would be asked those questions and then I'd kind of give an answer, but want to sound intelligent and informative when I'm responding to any questions. So that's helpful.
Totally. Yeah, totally. Let's see, Sherry. So she said, I can tell you a question the staff will definitely ask. Cost parameters. That is 100% correct. And I think that's one of the really important things to keep in mind, is that because this is an existing piece of statute that will be reauthorized in what we call the Child Nutrition Reauthorization Act, there is actually no cost to this bill. And so, I think some people are like, no cost. And I'm like, the reason is because it's including it within this policy, and it's including it within existing federal funds. So this bill is a no cost bill.
I think this is super amazing. When I was in high school, I always wondered if there would be something administering eating disorders. When I was in gym class in high school, I would be made fun of because my backbone would stick out, and I actually opted out of gym, and I was in like a study hall because of that. My doctor actually recommended that when I was in school. So I think it's super, super amazing that there might be a bill to teach about eating disorders in schools. That's amazing. I wish I could have had that in school.
Thank you, Jenna. That is so helpful and really helpful feedback. We really, I think that was NEDA's goal, was how can we start addressing this at a young age as we're taking steps further. So thank you for that.
You're welcome.
We have another question. What is the name of the fund it is included in again? So the local school wellness program is included in the Child Nutrition Reauthorization Act. And so we'll make sure that this is all in those follow-up details for you. But I'm just going to type it here so everyone has it. Child Nutrition Reauthorization Act. If I misspell it, forgive me. There you go. Okay, so I'm going to move on because we actually have we have another ask, and then I'm going to walk you guys through your pitch. Okay, so this is something that I have heard from the eating disorders community for years. Really the need to increase eating disorders research funding. So this is your second ask of your member of Congress or their staff. So we are asking for the FY, that means fiscal year 2021, for the National Institutes of Health spending bill request to increase eating disorder research funding. So the average amount of research dollars spent per person affected was just 93 cents for eating disorders. This is compared to $81 for schizophrenia, $41 for autism, and you're not even getting me into kind of cancer and the other diseases that are a lot bigger priorities for the congressional government. And so what does that look like? So for NIH eating disorders research, it averages about $32 million each year between 2015 and 2018. And so $32 million, I look at it, I look at my paycheck, I say, wow, that's a lot of money. But if you look at the larger scale of how much funding is going to other disease-specific areas, it's not that much. So for example, if we look at bipolar disorder, they have about, I would say, $80 million. We look at schizophrenia, they're closer to about $400 million. And then Alzheimer's disease, etc., they're getting closer and closer to almost, I would say, the upper millions, closer to almost billions, I would say. So, looking at the overall perspective, we are very underfunded as it relates to federal NIH research for eating disorders. I was doing some math, and really what it comes out to is that about 11.11%, not even 1%, 0.11% of all NIH funding goes to eating disorders research. And for NIMH, National Institute of Mental Health, which is supposed to be the biggest funding pot for mental illnesses, only 1.25% goes to eating disorders research. So something's up here, right? Looking at kind of the breakdown, I think what's interesting is that 56% of NIMH research funding is for eating disorders, and 44% actually comes from outside of NIMH. So we're actually seeing research being done in NIH through a variety of institutes. And what I would say the reason of that is that there are so many co-occurring illnesses like diabetes and kidney failure, you name it, that really have an effect on eating disorders. And so that's why we're seeing a lot of these other institutes picking up eating disorders research. We have a comment here about possible selling point. Anorexia has the highest mortality rate of all mental illness, and yet we are so underfunded to the point of 93 cents per effective. With such a high mortality rate, eating disorders deserve this increase. Absolutely. Do you want to come and work with me? Because this is one of my main talking points. Absolutely. So that is a great point to emphasize. Thank you for she said, yes, I do. So thank you for making that point. That is one that we'll talk about in a little bit, but you'll see that hitting on. So looking at more eating disorders research funding, so we have what's called committee report language. So in our big old FY21 spending bill, you have what we call the line items. This is the amount of money per each institute that everyone gets. And then within it, Congress provides a report that basically gives instructions for the federal agencies and institutes on what to do. So what we are going to be trying to do is include report language that instructs them to increase eating disorders research funding across multiple institutes. So as you can see here, I'm going back, you see NIMH is only about half funding for eating disorders research, and then there's 44% in other areas. We're asking for overall NIH increased funding, not just NIMH. So looking at, there are four main things that this report language does. The first, it highlights the severity of eating disorders and that multiple institutes study eating disorders. Second, it emphasizes existing gaps in research. Third, it strongly urges NIH to increase eating disorder research funding across multiple institutes and centers, including NIMH. And fourth, it directs NIH to provide a report of what they do for FY 2021. So let's see here. We have a couple of comments. Oh, just the bottom one. Okay. Thank you, Luke. Lara says she's a huge advocate for NEDA. However, how do we address people who think it could contribute to a rise in eating disorders if discussed with students? That is a great question. Really what a lot of the research comes out to is that, prevention typically starts with having that conversation. So it is a bit of a misnomer, just like with suicide. If you ask someone, are they considering taking their own lives? That is actually proven to be a way to prevent suicide, to begin that conversation. So it's the same thing with mental illnesses, including eating disorders, is that having that conversation is that first prevention tool. So looking at our congressional leaders of NIH research funding requests, here they are right now. What I will say is that I expect we may be getting some more in there. So House of Representatives, we have Congresswoman Kendra Horn. She is a freshman Democrat from Oklahoma. So meaning this is our first year or first congressional period she's been elected, and she is the main lead on the House of Representatives letter requesting this language. Congressman Brian Fitzpatrick, we are waiting for his final confirmation. He's almost there. So, you know, we're almost there. We will confirm with you by the end of the week, but he is expected to be our Republican co-lead on this. And then as well, we have a couple of other committee members who are considering this, which once we get them confirmed, we'll follow up with you on that. And then on the Senate side, which I know a lot of you will not be having Senate meetings. We are focused next week only on the House. But just for your knowledge, on the Senate side, we have Senator Tammy Baldwin, who sits on the Labor HHS subcommittee. She will be leading this request, along with Senator Amy Klobuchar, a Democrat from Minnesota, who's been a longtime eating disorders champion. She will be leading a letter with Senator Tammy Baldwin on the Senate side. Yeah. Okay, I'm just looking for comments here. When is this going to the floor? So how the funding bill works is that there's a lot of steps. You know, what I joke is that appropriations or funding bills, it's the Forever Lobbyist Act, meaning that we are lobbying it continually. So how this process works is that members of Congress will first submit the request to committee by March 13th. So that's what this letter that you guys are going to be asking your member of Congress to sign on to is going to be for. I'm going to go to the next page here. The letter is going to be asking them to sign on to this letter that will go to committee. Then committee will compile everything. Committee members will work on it. Then they'll start to what we do call a markup. A markup will happen typically, I would say, in May, June period on the House side. On the Senate side, it's typically between May and July. Sometimes they delay it a bit till September. And then when it actually goes to the floor, you're getting full procedure here. When it actually goes to the floor can be anywhere between August and December. So, you know, the House has been a lot faster, I would say, than the Senate. So the House last year, I believe they actually got theirs on the floor early in June, and then the Senate didn't get theirs on the floor till December. But what I would say is this entire process, I expect to be done between September and December of this year. Okay. Another question, if we do not know appropriations, what general funding are we asking for? So general funding is robust NIH funding. So that means we want much more funding than the previous years. Okay, so let's talk about everyone's pitch. Oh, hold on one second. I see here, Shelly, you asked, yep, I see it. Shelly, you asked, is there a screenshot that shows the flow? Are you referring to the flow of the appropriations process? Yes, okay. I do not have a screenshot of it, but what we can do is we can whip one up for you. And we'll make sure that everyone can then go from there. And just so everyone knows, we are recording this webinar, so you can always come back to the webinar afterwards. Okay, so looking at what to expect. All right, so your meeting, you got a schedule, or you're in the process of getting it scheduled. Your meeting will be 30 minutes or less. So please, please, please be on time. 30 minutes or less is typically how both congressional staff in Washington, D.C., as well as in your congressional district, schedule their time blocks on 30-minute blocks. One thing I want you to keep in mind is that these congressional staff that you will meet with will likely be young. And so when I'm saying young, I would say between the ages of 21 and 32 will likely be the age range that you will be meeting with when you're having this meeting. Some of you may actually have the member of Congress swing by. So right now in Washington, D.C., Next week, we are in full session, as we call it, meaning Congress is actually working. They fly back on February 28th. And so there may be a chance that the member of Congress may swing by the office and jump into your meeting. But otherwise, you'll likely be meeting with a congressional staffer who will be young. Things to keep in mind, they have a very limited attention span. Think of them as like toddlers. I only say that because I have one of my own, and keeping his attention is pretty limited. So I think that's just really important to keep in mind, is that they will be a little bit limited. Conference rooms may not be fancy. That's really important to keep in mind, is that some congressional offices or district offices are really nice. Some are not that nice. I know the one that I grew up in is not too nice. So just kind of keeping your eyes open and mind open to that possibility. And then congressional staffers, they may not hold exactly the political beliefs of your member of Congress. Sometimes the staff who work in district actually have been working in that district office even when the members of Congress change throughout the years. So keep in mind that they may not have it. So I would say just try to stay bipartisan. Two questions. Okay, so I'm looking here before I move. Hold on. Before I move on, I do have a couple of questions here. That said, you mentioned a deadline on March 13th. Does that mean that we must meet with our congressperson by that date? My congressman is not available on the 28th, but will get back to me about another date to meet. So we actually will be closing a letter on March 6th. So it's really important that you have that meeting before, I would say probably before March 4th or 5th, in order to get them to sign on. Because what happens is that they have to sign on, and then they have to run it up the chain, meaning they have to get approval from everyone. And then we go back to Kendra Horn's office, and she has to run around, her staff has to run around all of Capitol Hill to get everyone's official signatures by the 13th. So that's why we have that letter close date of the 6th. Also, as a friendly reminder, it is very unlikely that you'll be meeting with your member of Congress. So if you're reaching out, make sure that you're asking, whoever the congressional staff that NEDA originally paired you up with, making sure to mention, that it's okay that you're meeting with them. The member of Congress most likely won't make it, especially during election season. I'm just reading questions here. Okay. So Shelly asked, so should we try to schedule meetings in the afternoon of the 28th? Any time on the 28th work. If you or your group can't make it on the 28th, feel free to try for the days earlier or early the following week. We've all been trying to really get everyone to focus on the 28th, to have this really eating disorders awareness power week is the best way to think about it. So I would say try for the 28th, but if that doesn't work in the congressional staffers' availability, then just try those dates around it. But I would say the latest to try would be the 4th. Jenna has a question. She said, so we each will have individual meetings or just one meeting place? So, that really depends on everyone, I would say. So if it's going to just be you going to that office, then it is only going to be you in that congressional meeting. Some of you may have other people who are going to be joining you from your congressional district. If that's happening, NEDA will be connecting you all together on how that works. You'll probably want to meet somewhere first before you go into the congressional office. Okay. Thank you, Jenna. All right, so step-by-step meeting. So I'm going to walk you all through step 1, 2, 3, 4, 5, etc. for your pitch. One thing to keep in mind is that you will be receiving this PowerPoint at the end of this week, as well as a cheat sheet that has this information on it. So just to start, we'll be going through introductions, eating disorder 101, personal stories, the policy pitches, and questions. So introduction. So the first thing you're going to want to do is you're going to want to introduce yourself as a NEDA advocate. You can say something like, we are advocates with the National Eating Disorders Association, which is the leading nonprofit organization in the U.S. supporting individuals and families affected by eating disorders. Or you can just say you are a NEDA advocate, whatever you prefer. One thing I also would encourage you to mention is that if you are meeting with congressional staff next week, flag them that this is National Eating Disorders Awareness Week. They probably don't know. So I would definitely flag them at the importance of that week. Whoever is in attendance, whether it is just you or it is a group of people, everyone should introduce themselves with their full name, where you live within the congressional district, and your profession, whether you're a student, you're a mom by day, superhero by night, a researcher, etc. You'll want to definitely introduce what your profession is. And then you're going to go into some very basics of eating disorders 101. What I would say is that all of you here on this call or listening to this webinar most likely have more knowledge about eating disorders than the congressional staff or the member of Congress. So know that you are already the experts before you even walk into that door. But what I will also say is it's okay to just keep things brief, right? So it's good to hit the higher level points. So remember, you got to keep everything within 30 minutes. So you don't need to be starting a college lecture with them. You can keep it briefer. So here are some of the things that I would mention if I was you. I would first mention that eating disorders are a serious mental illness that affects 30 million Americans during their lifetime. They have the second highest mortality rate out of any psychiatric illness, only second to opioid use, with one person losing their lives every 62 minutes as a direct result of an eating disorder. So those are two really important points. So when I'm pitching here in Capitol Hill, those are the #1 things we lead with here. It's serious, it's very prevalent, and it is a very high mortality rate. Also, we always include that they don't discriminate. Eating disorders affect all genders, ages, races, ethnicities, socioeconomic classes, and sexual orientations. And then finally, one thing that we always mention is that they are biopsychosocial illnesses, making them super complex to treat. So because they're so complex to treat, they also have co-occurring medical and mental conditions like diabetes, PCOS, substance use, PTSD, amongst so many others. So that's really important. These are really the top things that I mentioned, but you can feel free to mix, match, and really pick which ones you feel most comfortable on. And I would also say, don't get caught up in saying the words. Don't let perfection be, the converse to getting everything out that you need to say. Jennifer asks, is there any way to get this before my meeting tomorrow? Jennifer, absolutely. Congrats on getting a meeting so early. If you could just shoot us your email in this text box, we'll make sure to get you that information as soon as possible before your meeting tomorrow. Okay, step 3. So you first want to talk about the Eating Disorders Prevention in Schools Act policy. So you will all have an infographic that you will want to pass out before or during your meeting. It's going to be solely on the Eating Disorders Prevention in Schools Act. You're going to hand them the infographic, and then you'll start talking. So people say, Katrina, why are we handing them the infographic? Why wouldn't we start? They're not going to be paying attention. Well, here's the thing, is that the majority of people are actually visual learners. Only about 20% are auditory learners, and then the rest are kinesthetic, meaning that if you're just speaking at them, they're only retaining a little bit of what you're saying versus if they have something to look at while you're talking. So that's why I always say, start handing your infographic first. Then just go through the issue, right? And it's okay to keep this very brief. These are a couple of talking points you can use, but you don't have to use them all. Usually you can start with eating disorders and disordered eating habits. They begin young. You can say 1 million adolescents per month partake in weight control behaviors. And there are high numbers of students who are at high risk or warrant clinical referral for an eating disorder. However, our school wellness policies only require nutrition education and obesity prevention. So really what our solution is here is all we want is eating disorders prevention to be included within local school wellness policies so that we can start preventing eating disorders early. This is a bipartisan bill led by Congresswoman Adams and Congress someone that you will soon know of soon. And it's going to do three things. It's going to require eating disorders prevention within school wellness policies. It's going to encourage screening for eating disorders. And it's going to ensure mental health experts are included in the development of and training and technical assistance for local school wellness policies. So that's it. You say, yeah, you make it sound so easy. That's usually what advocates tell me, and they laugh and they say, I'm too nervous. Don't worry about it. Remember, if all you say is eating disorders and disorder eating habits begin young, and we want eating disorder prevention policies to be included in local school wellness policies, that's all you need to say. Don't worry about getting caught in the details. If you want to include it all, that's great. If not, do what you feel most comfortable with. And then you always, this is the most important thing. So before, yes, do what you feel most comfortable with. If they hear anything out of your mouth, this is the most important thing right here. Please co-sponsor the Eating Disorders Prevention in Schools Act. That is the most important thing. And then you'll go on to your second pitch. So the second pitch is a request to increase NIH research funding. So same thing, you'll have an infographic here. You're going to want to hand them the infographic because remember, they may not be an auditory learner, they may be a visual learner. And then you can start with just some basics. Eating disorders research has historically been underfunded despite the high prevalence rate, high mortality rate, and highest treatment costs compared to other psychiatric illnesses. Going back to you guys earlier, you mentioned that, right? That is exactly the point we're trying to make. We have a high prevalence, we have a high mortality rate, it's expensive to treat eating disorders, but we are not getting the dang funding that we need. You can add emotion to it if you would like. And then you can go on to, however, NIH actually recognizes the complex need for eating disorder research, with almost half of the funding coming from other institutes in NIH outside of NIMH. So in turn, what we're asking for is congressional pressure to increase eating disorders research funding in multiple institutes. This is a bipartisan effort led by Congresswoman Horn and Congressman Fitzpatrick, where we're strongly urging NIH to increase eating disorder research funding through committee report language in the FY21 spending bill and direct NIH to provide a follow-up report on their actions to increase funding. That follow-up report, if you guys are wondering, that's meant to hold them accountable. And then the final thing, the one thing on this that you want to ask them is please sign on to the FY21 appropriations letter to increase eating disorders research funding by March 6th. Okay, so I'm going to pause on the policy stuff. Does anyone have any questions before I move on to personal stories and how to close things out? Okay, so the next, and what I would say is, in my opinion, one of the most important parts is that you are telling your personal story. This is what you know best, right? And this is what you really want to make sure that you are telling the congressional staff, or if the member of Congress pops in, your personal story. So here are some basic do's and don'ts of telling your personal story. First, limit it to 2 to 3 minutes. You may think, oh my gosh, that's so hard, Katrina. How can I possibly limit it? I know it's so hard. You have a lifetime to tell. But just remember, you want to make the story short and succinct so that they can remember it and tell their member of Congress. The longer it is, the harder it is for them to remember all those details. Make it short and succinct and practice. So you'll even notice if in my office here, we actually usually practice our pitches in the mirror. So that's one thing I can recommend to you is practice your pitch. Whether you want to record yourself, do it in the mirror, etc. I just recommend practicing it and timing yourself to see where you're at. If you go over 3 minutes, it's okay. It's not the end of the world, but that's really what I would recommend you trying for. I would say include details about how it affected your life. Did you miss work? Did you have poor grades? Were you distant from your family? Did you have to quit a hobby? These are all really important details. You don't need to just say, oh, you know, I battled with bulimia, or I battled with binge eating disorder, and now I'm recovered. Including those details really hits home to really how life-changing having an eating disorder can be. So that's why I would say definitely including those eating disorders or eating disorder details. But then what I would also say is make sure that you're including them responsibly. If you're looking at the last bullet point here. So, you know, while I want you to talk about how it affected your life, try not to use numbers. Try not to use that information, because you don't know if that congressional staffer may themselves be battling. You don't know what's triggering. So we want to make sure that you're telling your story responsibly. So for example, instead of I purge X times a week, try something like my eating disorder behaviors were so out of control that I didn't have time for anything else. You know, you can talk about things in detail, but without including the how details, the how you may have managed it. Additionally, you want to loop in details about your congressional district. They care about everything related to the district. If I bring them stuff about the nation, if I bring them stuff even about their state, they typically don't care. They care about their congressional district. So, for example, if you had BMI testing in your gym class that maybe you found was triggering, you can say, my middle school tested our BMI, and that's really when I started really to diet that triggered into disordered eating habits. So really think about how you can tell your personal story with including in things that they probably know. Maybe they know of your school, maybe they know of a hospital system, maybe they know of a street, including those details. And then connecting your story to the Policy Act, whether it's prevention in schools or more need for research. Okay. So just as an example story here, this is a completely make-believe one. So I have no citation for this. But just as a story, a good one might be, you know, I was battling with anorexia for 3 years. Really what was happening was that before I started battling with the eating disorder, I started being BMI tested within my schools. And, you know, it was really particularly hard on me because instead of even having a health professional do this BMI testing, they actually had our 7th grade male colleagues within the gym class testing our BMI. And it was just very embarrassing. My BMI came back and they told me that I was obese, and it really just started a projection into dieting, and then soon dieting became use of laxatives and so that's really what triggered my eating disorder, and I'm lucky enough to have found treatment and have recovered and in recovery since then. But really having eating disorder prevention in schools from the beginning would have prevented me from ever even getting onto that journey. So it's not the best story, right? You guys probably have more powerful stories, but that's an example of how you might include something. Okay, and then step 5, the final ask in the question. So, you know, you may say something like, I've heard from these personal stories, it's really important that we work to prevent eating disorders in schools and to fund more research. So I just want to reiterate that we would love for our congressman or congresswoman to co-sponsor the Eating Disorder Prevention in Schools Act and to sign on to the FY21 appropriations letter to increase eating disorder research funding. And then you can mention to them that NEDA will be following up with them with all of the materials. Okay, so just going to give you guys some final tips and we'll open it up for questions here. Final tip, be nice. As your mother always told you, be nice. Build a relationship with the congressional staffer. Think of this as just the start of the beginning of a relationship that maybe in future years you can shoot them an email, you can call them asking them to support other eating disorder policies. So think of it as a relationship building meeting. Be on time. And if you're going to be late, give them a call. Stay bipartisan. As I mentioned, not all staff are the same political beliefs as their boss. So don't just assume that they do have the same political beliefs. Pause between each section. Make it a conversation. It doesn't have to be a monologue. It can be a conversation. Take their cues. If they are about to ask you a question, let them ask that question and then continue on from there. If you have more than one person attending the meeting with you, ask them to take notes on the question and then let NEDA know what questions that the congressional staff are asked. And then always feel free to send a short thank you email after the meeting, thanking them for their time. Oh, Shelly has a question here. As far as research, as far as research funding goes, can you identify a bit more specifically what research it will be going to? Will it be going to identifying genomic factors and causes of disorders or treatment focus? So it's much broader, Shelly. And so we have some examples which you'll see in the exact report language. But when it comes to the spending bill and committee report language, you can't actually do too much targeting. It actually does a broader thing. However, what I can assure you is that NEDA is focused on every aspect of eating disorders research. So we are compiling all of the needed areas of research right now. We're working with a variety of stakeholders, and we're trying to address all areas of research as we're advocating with NIH themselves. Renee asked, if we have others attending the meeting with us, is it just the lead that provides all of the info on what we are asking for and tells the personal stories? So Renee, if you have others attending the meeting and you are the lead, you handle pretty much all of the policy, but then everyone gets to introduce themselves and tell their personal story. So if there are multiple people, it's best just to have one person to walk through the policy act, and then everyone else will definitely introduce themselves and tell their personal story. Mel, where is the recorded version of this? Where will it be located? I have some people coming with me that need to hear it. Mel, let me get back to you on that. We're recording it. So I'm guessing it's going to be a link. Again, my technology advancement is limited, so let me get back to you exactly, but you'll definitely get some variation or link for it. How do we know if other advocates will be attending the meeting with us? You will likely be looped in through NEDA if other advocates will be attending with you. Okay. Oh, Mel has another question. Can we please be scheduled to other meetings since our reps will not be available, and they'll most likely be available to meet with us and team will be able to. So Mel, I would say, I guess my question is are any of the congressional staffers available for your member of Congress? Because typically member of Congresses don't attend these type of meetings. So their staff would be likely the best because they're actually the policy experts over their member of Congress. Have you tried to actually talk to get a meeting with their congressional staff? You're working on it. Okay, great. Yeah, what I would say is that it's most effective when you're the constituent. But how about you'll see Carrie's email at the end of this presentation, and we can talk more offline on how to handle this. Okay, so next steps here. So NEDA will be sending you all of the Advocacy Day materials by February 20th. It may be a little bit later, maybe 24th at the latest, with the exception of, I believe it was Jennifer who said she has her meeting tomorrow. This will include the infographic for Eating Disorder Prevention in Schools Act, infographic for increased NIH eating disorder research funding, the congressional sign-on letter for increasing NIH eating disorder research funding, the cheat sheet that's just for you, as well, we'll also send over this PowerPoint. You will also receive a survey, which we're hoping that you can follow up with after your meeting, just to confirm how your meeting went, what you learned, and that the meeting actually happened. And then NEDA will also help you with any questions. You'll see information at the end of this presentation on who to email to discuss any questions you may have. And then we will also be following up with the congressional offices after your meeting to say, hey, you met with Jen, you met with Mel, you met with Jessica, etc. You know, they asked you guys to do this, please do it. For next steps for you guys, if you schedule the meeting, make sure to send an email confirmation to the congressional staffer, just confirming that we have a meeting at 1 p.m. on February 28th, whatever that may be. If you have other advocates joining your team, ensure they know where and when to meet. NEDA will be contacting you if there will be other advocates on your team. If you don't hear from them, then you will not have any other advocates on your team. I recommend that you meet about 30 minutes prior if you have a team, just so that you can get to know each other and talk a little bit. Also, maybe nice to know others within your community. Also, print 2 copies of the 2 infographics and the appropriations letter. Practice your policy pitch. Practice makes perfect. Practice your personal story. Make sure to send a short thank you email after your meeting. Make sure to also post pictures about your advocacy day and tag NEDA. And so we have the hashtag down there, hashtag NEDA awareness. So make sure to post pictures. We want to see how exciting and fun your day was. And you know, encourage others to advocate more in the future. And then, as I mentioned, complete the NEDA survey following the meeting. See, Renee asked, you said where we can find the infographic. NEDA will be sending you these infographics, we expect, by the end of this week. Okay, opening up for questions. Does anyone have any questions? Are NEDA t-shirts available on your site? That I don't know. I'm guessing so. NEDA team, can you respond to that one? I don't know. Are NEDA t-shirts available on your site?
This is Jocelyn. I think, yeah, we should have some available on the store that is linked from our website.
Great. What other questions may you have? What attire is appropriate? Would a NEDA shirt be inappropriate? I would say a NEDA shirt would not be inappropriate. I think in particular, since it's National Eating Disorders Awareness Week, it would be above and beyond appropriate. But if you don't have a NEDA shirt, you know, I would say business casual is a good one. So at least on the East Coast, what that means, which I know I've learned recently, that means different things everywhere. But that could be, for example, a blouse, or for men, a button-up shirt and a pair of jeans. And you can always get more formal, right? Like if you want to wear a tuxedo, wear a tuxedo. If you want to wear a suit, you can wear a suit. But I would say bare minimum, I would say business casual with jeans and maybe a nice blouse or button-up shirt. What other questions might we have? Okay, great. Well, thank you, everyone. I am, look at that, 3 o'clock on the dot. I don't waste 1 minute of your time here. Well, I've been so happy to have you guys all on. Really, really appreciate you taking your time. If you have follow-up questions, please do email Carrie. Carrie also works very, very closely with me and with Luke and everyone else on our team, so we can answer all of your questions. So her email is there. And then I believe, Jen, we will be emailing you with that information in short order here. Y'all have a great day, and happy Eating Disorders Awareness Week next week. You guys are going to kick it. it off.